Hello everyone, welcome back to our channel. So today we are going to learn about silent killer. What do you mean about the silent killer? So silent killer means high blood pressure, that is hypertension. About 1 of 3 adults in the United States has high blood pressure, which increase the risk for heart disease and stroke. The first and third leading cause of death in the United States is hypertension. High blood pressure is called the silent killer because it often has no warning signs or symptoms, and many people don't realize they have it. What is blood pressure? So, blood pressure is the force of blood against your artery walls as it circulates through your body. Blood pressure normally rises and falls throughout the day, but it can cause health problems if it stays high for long time. Next, we'll see what is hypertensive crisis. Exists when blood pressure reaches level of 180 or higher for the systolic top number or 110 or higher for the diastolic, that is bottom number. Next, we'll see signs and symptoms of hypertensive crisis. First one, severe headache, severe anxiety, shortness of breath and nosebleed. You need to call 108. This is emergency number. So next we'll see about hypertension general information. High blood pressure often has no warning signs or symptoms. Some health condition as well as lifestyle and genetic factor can put people at high risk for developing high blood pressure. However, everyone can take steps to lower their blood pressure. Next we'll see what is causes of hypertension. While the exact cause are unclear, many factors lead to the development of high blood pressure. These include smoking, obesity, then inactive lifestyle, eating overly salty food, more than 1 and 2 alcoholic drinks per day, then stress, old age, genetic and family history, chronic kidney disease, adrenal or thyroid disorder. That's all. Then what can happen if high blood pressure is not treated? Chest pain, heart failure and damage, heart attack, stroke, artery damage, kidney damage, vision loss and erectile dysfunctional. Next we'll see measuring your blood pressure. How you are measuring your blood pressure? So blood pressure is measured using two numbers. The first is systolic. This number represents the pressure in your blood vessel when your heart beats. The second one is diastolic. The diastolic number represents the pressure in your vessels when your heart rests between beats. If the measurement reads 120, that is systolic, and 80, that is diastolic, you would say 120 over 80 or write 120 by 80 mmHg. Next is prehypertension. Prehypertension means blood pressure levels that are slightly higher than normal range. It increases the risk that you will go on to development chronic high blood pressure. The American Heart Association defined prehypertension as systolic 120-139 and diastolic is 80-89. These all are blood pressure readings. Category hypertension, prehypertension, high blood pressure stage 1, high blood pressure stage 2 and last one is hypertensive crisis. Next we'll see types of hypertension. So first is primary hypertension, which include obesity, family history and unhealthy diet. Secondary hypertension leads another medical condition. Accelerated hypertension leads target organ damage. Gestational hypertension means during pregnancy and white coat hypertension. Next we'll see what is happening during diabetic. If patient is diabetic, then what happens? It's affect body's use of hormone called insulin. This hormone tells the body to remove sugar from the blood. With diabetes, the body either doesn't make enough insulin, can't use its own insulin as well as it should or both. This causes sugars to build up in the blood. About 60% of people who have diabetes also have high blood pressure. Next we will move on to the diet. Sodium is the element in salt that can raise blood pressure. Most of the sodium we eat comes from processed and restaurant foods. Eating too much sodium can increase blood pressure. Not eating enough potassium from fruits and vegetables can also increase blood pressure. So next we will see weight and physical inactivity. What happens? Being overweight can cause high blood pressure. Not getting enough exercise can make you gain weight, which can lead to high blood pressure. Next is alcohol use and tobacco use. Drinking too much alcohol can raise your blood pressure. Smoking raises your risk for high blood pressure. Age and race. Blood pressure tend to rise as people get older. African Americans are more likely to develop high blood pressure. Family history. High blood pressure can run in families. People can inherit genes that makes them more likely to develop this condition. The risk for high blood pressure can increase even more when heredity is combined with unhealthy lifestyle choices such as smoking, cigarettes, eating and poor diet. So what you can do? Eat a healthy diet. In that, eating healthy can help keeps your blood pressure down. Eat lots of fresh fruit and vegetables which provide nutrients such as potassium and fiber. Also eat food that are low in saturated fat and cholesterol. Avoid sodium. Maintain a healthy weight, like losing weight can help your lower blood pressure. Be physically active. Like the Surgeon General recommends that adults should engage in moderate physical activities for at least 30 minutes on most days of week. Don't smoke. Smoking injures blood vessel and speeds up the hardening of the arteries. Further, smoking is a major risk for heart disease and stroke. Limits alcohol use. If you drink alcohol, you should do so in moderation. No more than 1 drink per day for women or 2 drinks per day for men. Check your blood pressure. Getting your blood pressure checked is important because high blood pressure often has no symptoms. Treat your medical condition. In that, prevents and manage diabetes. You can reduce your risk for diabetes by eating a healthy diet, maintaining a healthy weight, and being physically active. Treat high blood pressure. If you have already high blood pressure, then your doctor may prescribe medication in addition to lifestyle changes. Take your medicine as directed by your healthcare provider. Then next we'll see drug therapy. Usually the first choice of therapy are diuretics or water pills that rid your body or excess salt and water enough through your urine. If this doesn't work, there are also ACE inhibitors, RBAs, beta blockers and calcium channel blockers. For extremely high BP, 2 drugs may be prescribed at one time. Primary prevention. Avoid the lifestyle risk factors that lead to hypertension. Be active, eat healthy, don't smoke, don't drink large amount of alcohol. And secondary prevention, get your blood pressure checked regularly when you visit the doctor. And tertiary prevention is set a plan with your doctors involving lifestyle changes and possibly medication. Follow up on regular schedule to make your stay on top of your plan.